Hello and welcome. I'm Dr. János Major, pain physician and pediatric gastroenterologist. I've been working in the last more than 10 years in pain medicine and treating a lot of patients, young people, young adults with pain and irritable bowel syndrome. I will tell you some information about IBS and gut-directed hypnosis now. Irritable bowel syndrome. Irritable bowel syndrome, also known as IBS, is a long-lasting condition that affects how the bowel functions. Unlike some illnesses, IBS does not stem from a specific physical problem in the body. Instead, its symptoms such as bloating, constipation, and abdominal pain arise from changes in how the bowel works. These changes can include increased sensitivity in the bowel or alterations in bowel movements. Today, IBS is understood as more than just a gut problem. It is seen as a disorder of the strong connection between the gut and the brain, known as the gut-brain axis. This connection allows the gut and the brain to communicate with each other through the nervous system, hormones, and the immune system. We can often see this connection in our daily lives, like when we feel butterflies in our stomach, when we are anxious, or when stress causes changes in our appetite or bathroom habits. The biopsychosocial model of IBS. Today, the biopsychosocial model is used to understand and treat irritable bowel syndrome, IBS. This approach considers not just biological factors like genetics and physical health, but also social and psychological factors that may affect the condition. These different factors work together to influence each other and shape the symptoms of IBS. Because of this complexity, it is difficult to say that IBS has one single cause. One of the most important factors we need to consider is stress. When we experience short-term stress, our bodies react in ways that are natural and help us to survive. This can include a faster heartbeat, tense muscles, and slower digestion. These reactions are meant to help us deal with challenging situations. However, if we experience stress for a long time, these responses can continue and lead to physical problems such as issues with digestion. The way we handle stress is influenced by our environment and how we cope psychologically. This includes managing our emotions and our sensitivity to bodily sensations. How we understand our physical feelings is also crucial. If we see our symptoms as normal results of stress, we are more likely to cope actively with the stressors and the emotions they cause. On the other hand, if we think of these symptoms as signs of a serious and unknown illness unrelated to our emotions, the stress can turn into a long-term issue. Other psychological factors can make this situation worse. For example, paying too much attention to our symptoms, imagining worst-case scenarios, often called catastrophizing, and feeling anxious or depressed about these symptoms can lead to a stronger perception of these issues and make them last longer. Among environmental factors, early life trauma can play a role in the development of IBS by affecting how the body manages stress. Additionally, the beliefs and actions of parents can influence these conditions. For instance, children whose mothers pay a lot of attention to their illness symptoms, such as allowing them to stay home from school frequently, tend to have worse stomach aches and miss more school than other kids. These different factors work together and contribute to the complicated causes of IBS. There are several biological factors that help develop and maintain IBS. These include an imbalance in gut bacteria, inflammation, infections in the intestines, increased sensitivity of the bowel, or a higher permeability of the gut. All these factors are linked through what is known as the gut-brain axis. In IBS, when the brain receives signals from the organs in the digestive system, it can become more sensitive to these signals, leading to a greater feeling of discomfort and pain. For example, certain foods that are high in food maps like apples and onions, can start to ferment in the gut, leading to the production of gas. This is a normal process. However, people with IBS often become overly sensitive to what happens in their bodies, which can cause them painful symptoms. In simpler terms, the problems faced by individuals with IBS are not just because of what they eat, but rather due to an extreme sensitivity in the gut-brain connection. Another example of how the gut-brain connection can be affected is when a person hears their stomach rumble, especially after they have tried to limit their food intake to avoid symptoms before going out. While stomach rumbling is generally not harmful, those with IBS may feel it more acutely due to their increased sensitivity. This feeling can lead to anxiety, making someone worry that if indicates a serious stomach issue like diarrhea, even if it isn't. Such fears can result in a person wanting to stay home more often. If this situation occurs repeatedly, it can lead to feelings of loneliness, which may contribute to apathy, sadness, or even depression. These emotional shifts can make pain worse. This creates a cycle where physical, emotional, and social issues keep affecting each other. A variety of methods can be effective at treating your IBS. Medical treatments include medications designed to relieve symptoms such as antidiarrheals, laxatives, and fiber supplements. Probiotics may help restore a healthy balance of bacteria in the gut, strengthen the lining of the intestines. Sometimes doctors prescribe antidepressants because they can improve how a person feels, pain, their mood, bowel movements, sleep difficulties, and anxiety. Making lifestyle changes like following a low FODMAP diet can also help reduce symptoms. Additionally, psychological therapies can be very helpful since the physical, mental, and social aspects of IBS are all connected. Gut-directed hypnosis for IBS. Gut-directed hypnosis is a psychological treatment that has been shown in many studies since the 1980s to help reduce symptoms of IBS. Because of this, major gastroenterology groups like the British and American associations recommend it as a second-line treatment, meaning it can be used along with the medical treatment if the first treatments, like medication, don't help enough. It works especially well for people whose symptoms don't improve with medicine. Research shows that it can help about 75% of people feel better in the long term. It can reduce stomach and bowel symptoms, physical discomfort, anxiety, depression, and it can improve quality of life. It does this by helping the brain and gut to work together better and by calming the body's stress system. Hypnosis works by focusing on mental processes that we don't usually control on purpose. During hypnosis, a person is very focused and open to suggestions, often while feeling deeply relaxed. In gut-directed hypnosis, the therapist uses positive suggestions and mental images to help people feel stronger and more in control and to reduce how strongly they notice stomach or bowel sensations. The goal is to make these sensations feel less intense, help the person feel more in control of their symptoms, and help the gut work more normally. Therapists may also use calming mental images to represent how the gut should function. Research shows that hypnosis changes how the brain reacts to signals from the gut. It makes symptoms feel less intense, reduces the person's focus on the discomfort, helps separate the physical feeling from the stress or negative emotions often linked to it. Hypnosis is a technique that helps us learn how to use our minds and thoughts to manage unpleasant emotions and physical symptoms, find resources and solutions, and develop new behavior patterns. The experience, while maybe a little unusual, may not seem so different to ordinary everyday experiences. It is largely a question of your willingness to be repetitive, receptive, and responsive to ideas, and to allow these ideas to act upon you without interference. When used by trained professionals, it is ethical and safe. No special preparation or knowledge is needed to undergo hypnosis, just an open, curious mind that allows things to happen naturally. There are many misconceptions about hypnosis in the media. For example, misconception one, the person being hypnotized will be under the control of the hypnotist, can be made to do or say anything the hypnotist wants. This is false. During hypnosis, the person remains in control of their actions and is aware of what is happening around them. Person cannot be forced to do something against their will. Misconception 2. Hypnosis is something that is done to people rather than something that they can do for themselves. This is not true. You already have the ability to experience hypnosis, or you can easily acquire it. The purpose of hypnosis is for a person to learn a new skill that makes them feel better. Misconception 3. People become trapped in hypnosis and cannot come out of it when they want to. This is completely false. People can end hypnosis whenever they want. Hypnosis is self-induced. The trained professional only helps this process. Since we induce hypnosis, we can end it at any time. Misconception 4. People have to be very hypnotizable or suggestible or gullible for hypnosis to work. This is also wrong. Furthermore, being hypnotizable or choosing to be responsive to suggestions means only that you have the ability to use hypnosis effectively. It is not at all related to being gullible or weak-willed. However, research shows that hypnosis can be useful for most people, and you do not have to be especially hypnotizable to benefit from it. Misconception 5. During hypnosis, people are unconscious. This is not true. During hypnosis, people are not asleep or unconscious. Although they may feel very relaxed, they are active participants in the hypnosis session. They are aware of what's happening and they can usually remember what afterward. So thank you for your attention and I wish you all the best.